This is a demonstration of suctioning a tracheostomy tube. Generally, you will have a standing physician's order to suction PRN as needed, and in most instances, your suctioning equipment and supplies are all kept in the room. Good morning. My name is Mary. I'm going to be your nurse today. Can you tell me what your name is? Mr. Brown. All right, Mr. Brown. I'm just going to pull your curtain here, and I just need to check your ID bracelet. I do have a physician's order to suction you as needed, and you are sounding a bit congested. So I'm going to go ahead and suction you if that's okay. And you do have the correct bracelet on. Great. All right, I'm going to go ahead. I'm going to explain to you everything that I'm doing as I'm doing it. Have you had this done before? I know it's not a fun procedure to have done. All right, I'm going to take your pillow away because that'll make it a little bit less uncomfortable. I'm just going to set this to the side. And I've got my kit right here in the room. Got my ambu bag. I'm going to turn this on. Turn that all the way up. I'm going to turn on your suction. And I've got my saline. When I'm all done suctioning you, I'm going to go ahead and clean out your mouth and give you some mouth care as well. I want to open this up before I pour that saline, before I open that saline. Okay. First thing I'm going to do is connect my suction and make sure it's working. And that is suctioning well. All right, Mr. Brown, what I'm going to do, I'm going to disconnect your oxygen, and I'm going to give you 5 nice deep breaths. Now, as I put this tube down, it may make you cough. At that point, we'll pull it out. All right. It's coming out. You okay there? I'm going to give you some more breaths. All right, I'm just going to rinse the tube, and then we're going to do it all over again. Go down real quick. All right. Didn't get much out that second time. All right, I'm going to go ahead and put your oxygen back on. We're done the worst of it. And I'm just going to suction out your mouth. Okay. Let me just get rid of this and change my gloves. All right, this is just wet with water. Just give you some mouth care. There, does that feel better? Great. Okay. Turn this down a little bit. I'm going to take a listen to your chest again real quick. And I'll give you your pillow back. All right, I'd like you to take some nice deep breaths for me. And I'm just going to listen right around the side here and right around this side. That sounds much better. All right, let me give you back your pillow. Is there anything else I can get for you? Okay, let me lower your head. Make sure I have a kit in here in case I need it again real quick. And you've got your call bell in place. Great. Oh, must have set that off by accident. Just cancel that. All right. Is there anything else I can get for you? No? All right, I will be back shortly. Thank you. When I leave the room, I'm going to go and I'm going to document that I suctioned the patient, and I'm going to write a description of the secretions, their appearance, the amount, and how the patient tolerated the procedure.